Well, we all know the stories of the insured. We all know the stories in our own districts and our own states about those people that have health insurance, but they blow through the deductible and then they blow through the annual, or they hit the maximum benefit package that insurance, and then they're on their own. At that point, they sell their house and they often wind up in bankruptcy. The other part of what's happening is the downturn of the economy. Millions of Americans have lost their job. You lose your job, you lose your health care, you have no way of paying for COBRA, even though this bill and the previous bills that this House has passed and the Senate has passed and become law do provide a subsidy to help people stay on COBRA. But even so, if you're unemployed, you have a heck of a time trying to make that payment. So people lose their jobs, they lose their insurance, they lose their health, they go bankrupt, and 45,000 Americans die because they've lost their insurance, so they never had it to begin with. So this is the story of America. The legislation that will be before Congress in the days ahead specifically deal with that problem. They deal with it, as Ms. Schacowsky has said, by saying that no longer will you lose your policy when you get sick with medical underwriting or post-event underwriting. That's one thing. Secondly, you will not be denied insurance because you have a pre-existing condition. And who doesn't have a pre-existing condition? It was at the summit that Representative Miller held up 3 pages, and he read each of these pages in small type was from an insurance company that listed the pre-existing conditions that they would use to deny coverage. Everything from acne, the story that you told earlier, to kidney illnesses or colds or whatever. I know a young lady, 23 today, that came off her family insurance, tried to go back to the insurance company that she had been with for her whole life, from the day she was born. They had all of her medical records, denied her coverage because she had acne. I think the real reason was that she was a female in that childbearing age. Now, she wasn't pregnant, wasn't married, wasn't likely to have a child anytime soon, but she was in that childbearing area. I said, this is not right. What's going on? She said, well, I tried to go online to get a policy. I said, that couldn't be. I said, give it a shot. So we, went online, put down her name, female, the health statistics, denied. No coverage available. I said, let's try something. Let's just change one thing here. Let's say instead of a female, you're a male. Bingo, she got coverage. The present system discriminates in the most pernicious ways. If you're a young female, you're likely to be expensive. Medical care of different kinds. You're going to give birth to your child. You talk about family-friendly policies? Not from them. So these are things that are corrected in this legislation.
Let me comment on this gender discrimination. I think the Speaker of the House, Nancy Pelosi, put it really well today. Some of the women had a meeting with her when she said, being a woman is a pre-existing condition.
Exactly.
And the truth of it is that pregnancy in some cases is considered a pre-existing condition. A C-section, a cesarean section, being a victim of domestic violence is a pre-existing condition that could make you ineligible. If you go out on the private market right now, only about 12% of policies actually cover pregnancy. Women overall are charged about 38% more for health care than men do. And in some cases, it's as much as 70% more than men for health care, just because we have slightly different, well, maybe extremely different parts to our bodies. That is so wrong. This bill ends gender discrimination. But I do want to say one thing about, I don't want to forget to say.
Before you go there,
let
me just make this point. This is the point to the insurance companies. The day the President signs this bill, your discriminatory practices are over. You will not be able to discriminate against Americans because of their health status, their marital status, their whether they are male or female. Those days are over. Listen carefully, health insurance. I know why you're spending that $100 million trying to oppose this bill because you know that the day we pass this legislation, the day this is signed by the President, your discrimination is over and every American is protected.